Okay, thank you. Well, I think it's officially good afternoon, everyone. Welcome to our workshop. Um, Angie, Anya, and I are very excited to present to you guys today. Angie, if you'd advance the slide.
Why is it not going? 1 second.
So we are going to talk to you guys today about our journey to create a patient and family focused website for COVID-19. And I'm going to we'll all kind of introduce ourselves, and then we'll go in and let you guys know a little bit about our hospital and organization. So my name is Jenny Shaffer. I manage our Office of Patient and Family Education and Health Literacy. And I have been a nurse at our organization for almost 19 years. Angie?
Thanks, Jenny. My name is Angie Lucia. I'm the web marketing manager at Stanford Children's Health. And so I manage all the digital properties at not only Stanford Children's Health, but also Lucile Packard Children's Hospital, Stanford. Anya?
Yes, I'm Anya Bodden, and I'm a strategic account manager at HealthWise.
So a little bit about us. Stanford Children's Health is one of the only healthcare systems in the San Francisco Bay Area that offers dedicated care to pediatric and obstetric patients. We have comprehensive clinical services that encompass rare and complex conditions, everything from well child care to heart transplants and surgical services. We're one of the most technology advanced, family-friendly hospitals for children and pregnant women. We do have a ACS verified level 1 pediatric trauma center, and adjacent to our hospital is one of the largest Ronald McDonald houses in the world.
And HealthWise, who is HealthWise? HealthWise has been doing patient education for 46 years. We are an independent and nonprofit company, and we, as HealthWise, produce trusted, effective education that improves lives. We serve as a catalyst for informed medical decisions and meaningful patient-provider collaboration. Our tools add value to workflow without unnecessary complexity. As a result, our clients achieve better health outcomes, added credibility, and stronger performance. Our mission is to help people make better health decisions. Next, please. So why HealthWise? HealthWise has the biggest, some of the biggest top health plans, providers, care management companies, and consumer health portals across the nation and Canada. HealthWise creates current evidence-based and easy to understand education, and it's written to the 4th to 6th grade reading level. We provide innovative technology solutions that integrate with complex IT systems. And HealthWise provides expert guidance on game-changing approaches, such as behavior change and digital health solutions.
Okay, we have no conflicts of interest to report. Next slide. So for this particular presentation, we really hope that you guys can understand how to create an effective partnership with multiple entities, identify key elements of patient and family education and optimize those elements for search engines, and describe the importance of making health education accessible to everyone. So for us, the real sort of grounding factor for all of this was the pandemic, so COVID-19. So for COVID-19, we found that at the very beginning, or from the very beginning of our sort of response, there was a lot of miscommunication and misinformation, as well as we were getting patients and families that were coming in as information was changing very quickly. They were sourcing information from multiple different sources. That we were finding that our rules didn't always align per state or per county, and we have patients coming from all over. And there was a high fear level of our patients. And so we really had to act quickly to handle some of these communication challenges. Next slide. So what we want to do, we're going to jump right into a breakout session. And really what we want to do is, as smaller groups, talk about what were some of the communication challenges in your organizations or your areas, and sort of what were the underlying factors and things that your teams had to address early on. So I'm going to divide you guys into 3 breakout rooms. There should be about 10 people each. And let me just make sure that we are all in each breakout room. I believe so.
It also might be nice just to take a minute and introduce ourselves when we hit the breakout room. And then if you feel comfortable sharing what your challenges are, it'd be great. Maybe once we get back to the main room, if we can maybe share with a bigger group.
Yep, perfect. Okay, so I am going to open up all the rooms and I will hopefully join room 3. So I will see you guys in a second. We'll just give everyone a minute to come back.
Boy, we heard some great stories.
Yeah, we did too. Okay, I think everybody's pretty much back. I can go ahead and start, and then I'll let Anya and Angie sort of get into the stories from their rooms or have their spokesperson do it. But from our room, and please feel free to jump in if I don't summarize well. But one thing that was mentioned was with this pandemic, we kind of had a lost sense of shared reality, you know, like with amongst everyone. Because it was new information and everyone was getting information from various sources. And then from the more clinical side or sort of organizational side, what was interesting was that, and we felt it in our organization as well, is that people lost, you know, they had to sort of work on crisis mode, which is something that for at least me, I had never dealt with before. Patient and family education had never been an emergency. And now it all of a sudden became an emergency because you had to get information out to a broad audience. So you either had to it had to be for clinicians, it had to be for patients, it had to be for their family. It had to be very identifiable and easy to access, and you had to sort of keep it all straight and updated. So that was the biggest challenges that my team kind of identified. Anya, or whomever your spokesperson is.
Absolutely. So I'll kind of summarize, and then I was going to have Christine give her story. But like what you said, Angie, I think that everybody was in such crisis mode. I heard a lot of change management and all hands on deck, people working 24/7, you know, trying to reach the older population. You know, how are they going to do that? And so it's just incredible to hear these stories. But Kristen, do you want to hop on and tell yours?
Yeah, hi. So thanks, Anya. Basically, what you guys have already said is exactly what we were experiencing at our large hospital system in Delaware. And what my story was basically was that one of our biggest problems was not just getting information to patients and families, but our own staff had the same questions and concerns and didn't know what to do. And as a nurse, I'm a nurse educator. So my job is to educate patients, but also to educate the staff. So that was what our team did. A lot of really jumped on board and helped out with disseminating that information consistently and accurately. And how we did that was we came together with partners in the organization, infection prevention and external affairs, and coordinated work on an intranet site for public use, but also an intranet site for our employee use and staff use, so that we can disseminate the policies and the procedures and the videos and everything that the staff needed to take care of patients and educate patients appropriately. Thank you.
Thank you.
Thank you.
And for our group, there was a common theme about getting the information disseminated to all the right demographics and all the right audiences. That, you know, multi-language is a big challenge. To hit all the people in their native languages, print, digital, social media channels, it can be very challenging, and to hit the rural regions as well. And also, you know, trusting the information that people hear, right? If they're an older population, maybe they don't have access to the internet or to a smartphone, or maybe they just don't trust the source. Do you guys want to add anything?
I think that's all of those points are very valid, and I really appreciate everyone sharing their stories, because I think stories are very powerful. Okay, Angie, would you like to pull the slides back up? And
You bet.
thank you. And so if you, next slide. And I think what you guys said is what they said was exactly what we were experiencing. And I believe that I apologize, was it Christy? A person that set up both websites ahead of time. I think that you guys were ahead of us by far. So what did we do as an organization? So we made a decision early on that we were going to send our sort of emergency custom content through our review process. So we had never really done this, and I'll talk a little bit to our review process. So at our organization, this office that we've created focused on patient and family education and health literacy is a relatively new entity in the organization. And with that office, we've developed, you know, this very strict process, some pretty, you know, evidence-based health literacy standards. And we had never, again, I had said, patient education had never been an emergency in our hospital, and that sort of resonated. We had never really had an emergency process for sending information through our review. And what happened was they made a decision, their command center, that everything was going to go through our review process. So it meant all hands on deck. Everything was going to get tracked through our intake system. Everything was going to get reviewed by our health literacy writers. We have a step where our parents and family actually review our education and do a check on the family-friendly language and the tone. And then we have a designer that actually reviews the design, and we work with our marketing team to ensure everything looks and feels the same. So we really decided early on that although it was an emergency, we wanted everything to have that look and feel and make sure it met our standards. Next slide. And so just a little bit about timeline to give you guys a perspective for what we experienced within our organization, and it may or may not be similar to what you guys experienced, but our command center sort of essentially opened kind of early February, and immediately the requests started coming in for material for staff and patients, as you guys identified. And that request sort of kicked off this like decision point where we were going to start ourselves up and running. And so really, we began with some general information about the pandemic using the CDC, Dr. Fauci, and some of those general resources. But we also had to ensure that we were making what we were saying also met our county guidelines, which didn't always line up with what Dr. Fauci was saying, which was a big challenge for us, because I think on a broader scope, people were hearing information come across news, broadcasts or the radio or social media, and they didn't always match with what we were saying. In mid-March, that's when our sort of COVID, our labor, we shut down all of sort of the world shut down, if you will. We shut down our elective surgeries and really pooled all our labor and started using our parent mentors. We have a great parent mentor partnership program in our organization and really did rounding, because what we were finding was the handouts and information we were producing weren't actually making it into the hands of our patients, because there was a lot of the nursing staff and clinical staff were under a lot of pressure. There's a lot of stress on their side because this was new. We weren't sure how to handle it. We were running into shortages. And so we really partnered with our parent mentors and we did room to room rounding, which actually really helped. Unfortunately, our surge and our change in ability to have people going in and out of the rooms and who could visit, who couldn't visit, limited that. We really had people stay home. Only nursing staff was really allowed into the rooms. We were doing a lot of telehealth and even into our patient rooms. And so that sort of changed our approach. And so we sort of had to pull back on that rounding, which had been working, and rely more on clinicians to hand out material or provide that information. Then we sort of took another change. Economically, our hospital had to readjust how we did things in May, because we were seeing the economic effects of closing down some of our normal sources of streams of income. And so we did some mandatory PTO. And so that also changed how my office operated and how we had to produce material. It became a little less of a group effort and more of a one-on-one person effort, which changed some of it. But we sort of figured out that process as well. And then we really realized that the clinician being the person, or the intranet site being the only sort of site where the information was held, was not going to work. And so our marketing team had already started putting links on our external website to CDC, to resources, but we really wanted to allow our external community to have access to the resources we've created. And so in August, the idea was sort of born that we needed an external, more robust education website for patients and families around COVID. And that dream sort of became more of a reality in October and went live in December. Now I'm going to hand the baton to Angie. Oh, before I do that, I'll show you what our materials look like. So this is just a glimpse into some of the materials that we created and sort of some of the more specialty information that we wanted people to have access to, but we were having a challenge getting it out to them. And then I will hand the baton over to, oh, sorry, Anya, to Anya, but Angie, actually one more, I'll just show everyone. I forgot that I wanted, if you could go back one, I wanted to show them.
Which way, this way?
Go back towards the beginning. I apologize. Other way, I think. If you go back.
1 second.
Sorry, Angie. I wanted to show, we just did a quick little overview of how many documents that we had reviewed. And really the sort of infographic that we created was just to give you guys an understanding that I think we've reviewed about maybe 100 pages of material. We've created about, I think it's about 70 different types of information and handouts and letters. Interestingly enough, for our organization, letters was a big way that we wanted to communicate with our external community. And we used MyChart a lot. And we've actually found a lot of real, not holes, but opportunities for our MyChart. I think we crashed the system once or twice, sending out too many messages. And so there was a lot of lessons learned because we had never done this sort of mass communication before.
Yes.
Do you want me? No worries.
Having some technical difficulties here. Let's try this.
There we go.
Perfect.
How about that?
So that's it. Thank you, Angie. Sorry, I was talking faster than I was having you pull up presentation. So this was just a report out that we did in the fall to sort of show since sort of March, what our sort of statistics looks like for reviewing information. Now, this is probably small compared to other people who have larger purviews, but this is sort of what we did. And again, really trying to make sure the information was accessible. And because it was emergency, we did translate most of our documents that we created, which was pretty powerful, because that had not always been available to do in the past. And so that really showed our organization the ability for not only partnering with our translation services, but really what they could do. Okay, now I will hand the baton over to Anya, and she will be able to tell you sort of how HealthWise responded.
I don't know why it's
It doesn't want to advance.
no, I think.
Do you want me to try?
Would you mind, Jenny? I'm so sorry. It's
No,
like
you're
frozen.
fine. You are totally fine. Let me pull it up. 1 second.
Welcome to Zoom.
I know, right? Okay. Let's try this.
Slide 14.
Okay. Give you guys. Is that better? Can everyone see? Awesome. Okay.
Beautiful.
Can you guys hear me?
Yes.
Okay, perfect. So HealthWise has a content creation process that we do every single day, and it's extremely robust. We plan, we research, we write, we review. That's how we create our education. And then we continually, on a weekly basis, monitor. We look for different things that's coming through. We review and we update. This is a very cyclical process. We have a librarian on staff, many content writers, medical content specialists, and physicians that all review every single piece of content weekly. And we push all of our content on a monthly basis to our clients. Next, please. So what is our process when an emergency happens? So I have to say that this is probably the biggest urgent issue that we've faced. I mean, we get them quite often, but we have a medical accuracy and consistency team that we call our MAC team that looks at our education again on a weekly basis. You know, usually the urgent topics are like the new ADA guidelines or PINA introduction. But with COVID, you know, we respond to those basically when, you know, when something's needed, depending on the type or the urgency. COVID was a whole different ballgame. It was 24/7, all hands on deck. None of our projects were happening. So every strategic initiative for content that we were working on was put on hold. We assigned a smaller team of writers, medical content specialists, just to make sure that we could produce at a very fast pace and make sure it was the source of truth and it was accurate. We used the CDC and the World Health Organization as our main sources, and the workflows were extremely fast. Instead of pushing out content to our providers and all of our base, which is normally monthly, we were pushing it out bi-weekly at this point in time. Next slide, please. So this is our timeline. So February 2020, we produced our first COVID-19 content. Then from there, March 2020, boy, we updated those pieces of content because if you guys remember things, everything was changing so fast. We deployed the twice weekly content delivery. And then HealthWise actually put up their own website, which was called our Coronavirus Resource Center. This resource center was not only for all of our clients, it was for our family, our friends. I pushed it out on my social media. So our team worked really hard, and they're just incredible. April of 2020, we always are updating our COVID content. So anything of change, we created new topics and videos. And then we started going from bi-weekly deployments to weekly, because things were kind of starting to like level out just a tad. May of 2020, standard quarterly delivery. So with our client hosted products, we deliver quarterly. And so that we delivered that on a standard basis, and again, updating and sending out new content. June through November, actually, we redeployed and reestablished our monthly cycle. So instead of bi-weekly and weekly, we were doing monthly. And of course, delivering the updated content and adding new pieces of content and videos. December of 2020 was our very first vaccine article that we pushed out. And we have been pushing out content on a monthly basis from, June on. And so that is how we came to the table.
Thank you, Anya. Yeah, and so I think what we realized as an organization and sort of is that we need to allow access to all this information. So HealthWise had some really great information. We wanted to sort of partner with our information that we had created, but really the only space that we had put it on, and really it was for maintenance as well as accessibility for our internal staff, was that we put it on our intranet. And I think somebody else had mentioned that. And so really everything was living on our intranet. We had access to HealthWise information on there, and we had access to our content. But again, that relied on somebody, a clinician, a care provider, somebody printing it out or sending it through a MyChart message. It was not a sustainable workflow because it wasn't a consistent workflow. So we knew we had to do something different. So Angie, I'll let you talk a little bit about this image, and then we'll go into our second breakout room.
Yeah, so this is a really broad map of our website traffic, and you can see by the callouts on the screen that it really is a global audience, that people are searching for information day and night, mostly through Google, and it's always on. So you really see the broad reach of having a robust website.
So I will go back. Oops, sorry about that. I will go back. Let me get back to you guys. I'm going to stop sharing for a second, and I'm going to get everybody into our breakout rooms again and just talk a little bit amongst yourselves about ways that you guys get information out to the different audiences that you serve. Okay. Okay, thank you guys. I think we'll give everyone just another few seconds to get back from their breakout rooms. And then I might have
anyone sharing that?
Sorry, Angie, did I cut you guys off too soon?
No, I was just going to ask Dylan to share her experience because she had a really good story to share.
Awesome. Okay, I have one too. So I think maybe we'll just have two people share in this session, if that's okay, just because I'm looking at the time and I want to make sure we get through the whole presentation. But I do think that stories are valuable. So go ahead, Angie, I'll have your team. You can start.
Go ahead, Dylan, you go for it.
Oh, so I was talking in our team that I work for the Department of Health here in New York City. I work for the Poison Center, and as a way to kind of mitigate all of the misinformation from maybe any other of our teams and all of that, what they did is that they basically kind of just allowed messaging only from a specific group within the health department. All of our, they made sure that if we talked about it, it was kind of like you had to change the wording. We really couldn't address COVID per se. It would just have to be like during this time, as you know, that kind of wording, just to make sure that they would basically really narrow down the messaging, and that they kind of had a clear voice as to one person or one group, and that they approve what they said.
I think that's extremely valuable. I was going to have Heather from our team share a little bit about how St. Jude's kind of got some of the messaging out.
Hi, that was actually one of the things that we talked about as well, is how do you put all the information in one place and streamline it so that people can find it. One of the things that St. Jude did is we actually have a website that's public facing, together.stjude.org. And so it was already in place, and we were able to develop a COVID landing page where we were able to put the information and resources geared toward different target audiences, from younger kids to school-age children to teens to parents, as well as survivors. And another resource that was able to be quickly used was St. Jude has a global community of providers around the world, particularly in low resource countries. And they were able to establish a COVID resource center, because certainly timely information was so important, because there was so much unknown about COVID in pediatric cancer populations, and the quick information sharing was extremely important as the researchers were learning more. And one of the things that came up was how challenging it was to write about COVID, particularly in online delivery, is because we didn't have any SEO information. And even the, your resources, even your paid resources that help you develop those keywords and search terms and know how people are using and talking about COVID, that information wasn't there or available for several months. And so you kind of had to guess, how are people searching this? What terms are they using? How are people going to stumble across this information that we're providing? So those are some of the things that we talked about.
Thank you, guys. And I'm going to share my screen again, and I'll get back to the presentation. But yeah, I think that you guys are all bringing up exactly sort of what we experienced too. And I think that's really the meat of it, and Angie's going to do a really good job as we go on to sort of talk a little bit more about how we looked at this from an external website perspective. But we decided we needed to pull a group together and collaborate. Well, that was really an iterative process, and I learned a ton, because I didn't realize how many people it would take to sort of set up an external website. At first, there was a very small group. I thought we could do it with just sort of our sort of external IS support, and then we realized, nope, we got to pull marketing, we got to pull clinical, really create a team. So that's what we did. And so we have our web services team, our HealthWise team, our nursing and physician colleagues, and then our web marketing team, which was huge. And they really went through this iterative process of reviewing material, the usage, the need, what would engage. I think that was a big thing. How could we draw people in? How could we really get people to engage with the website so they could find the information they needed? And then really, we had never taken our vendor, that just wasn't a thing that we had done with HealthWise before, and made their content accessible on our external website. So learning their whole API process, how to bring in and make the sort of URLs accessible and searchable and crawlable. And I learned all these amazing website terms that I had never really understood before. And then really, how do you optimize content to make it, so that it gets your message out? Because that was the goal. The goal was to get the right information to our patients and families. So I'm going to let Angie go over how wonderful our web marketing team is and how they do that, and what our user journey looks like at Stanford Children's Health.
So we do have our external facing property, and much like what Heather had touched on earlier about how quickly things were changing, we had all these chunks of content and all these other buckets. And so what was going to be the best way to ingest all that information and spit it out in a way that is palatable, searchable, and that our readers can find the information. So right now, I mean, Google pretty much owns the web. We get more than 80% of our web traffic directly from Google searches. We want to make sure that whatever content is published on our public-facing website is optimized as best as possible for Google and for our web visitors. We do a couple things on the back end. So we'll do some keyword research. We'll make sure those keywords are crawled by Google, because Google has a Google bot that actually goes out every night and crawls our pages. And so it ingests all that content. And so then when you as a web visitor go to Google and type in your search term, Google does a really good job with their own particular algorithm to return those results to you that they think are pertinent for that keyword search. There's a couple things we do internally too when we publish a new web property, and that we give it a shortcut URL so that's easy to use in print. It's easy to give out over the phone, and that was going to be key for this COVID-19 patient education project as well. We also do a really good job of internal linking from within our website, so that if a person ends up on one page, hopefully it'll entice them to go back and cross-link back and forth to get the information that they're looking for. So here's the iterative process that Jenny alluded to earlier. The initial mock-up was done by our IT team, and they're really good at the back end, but they're not so great at the front end. So when Jenny was assembling the team, our IT team kind of put this mock-up together, and you can see that, you know, it really wasn't meeting the business needs that Jenny was looking for. I was kind of brought in after that to look at the user journey, see how we could best serve up the HealthWise content and the custom content that Jenny's team was creating, and make that in a way that is going to be useful for our web visitor. So we kind of threw the baby out with bathwater and we started over again. We looked at the key components and the messaging that was going to be important, and we tried to bubble up those key areas to the top of the above of the fold of the page. So we knew that we wanted key call to actions available. We wanted to focus on the videos that were coming directly from HealthWise through the API. And we wanted to have streamlined navigation so that the web visitor could find their way through all the information. And so here's an example, I guess kind of like basic search engine 101, is that the content is structured on a web page and is done that way, not only for the web reader, but it's also done for Google. So it's important to have those key elements on the page so that your web visitor is getting the information that they're looking for, but also that Google can find that information. So when we looked at the content directly from our single source of truth, coming from with Jenny's team and Anya's team at HealthWise, we were looking for key characteristics that were very important to the page structure. One is unique, accurate page titles. You should have one page title for every page that you're creating, because that is the information that's going to be displayed in that top clickable link in Google. The meta description are up to 170 characters that can best describe the content of the page. Google's going to grab that information from the meta description tag, and it's going to display it on the search engine result page. So you want to make sure that you're going to capture the reader's interest by reading that small little blurb of the meta description underneath the title. When we talk about heading tags, H1, H2, H3, it really does give the web reader an opportunity to kind of see the structure of the page and understand what is important. If you kind of think of it like a book, right? Your H1 is the most important. That's kind of like your book cover. That's the title of the book. The H2 is kind of like the chapter, right? The H3, the H4, the H5, they're kind of descriptors that go underneath that hierarchy. So the H1 on the page is always the most important information snippet that you want to display. The H2, again, it's more like the chapter subhead. And then as you work your way down the page, obviously you're going to call out areas for each paragraph, kind of chunk of content that are important to your web reader. Let's talk a little about images. HealthWise had a slew of images that we also ingested. And with an image on the web is what they call an alt tag, also alternative text tag. And it's a good descriptor of the web, and that's key for accessibility. So we have a lot of visually impaired folks that will come to a website and they use a tool that will actually read the web page to them. So having an alternative text associated with each image is very important for the folks that use a screen reader. One key component that we do every time we launch a new website is we tie analytics directly to the web property. And that's important not only for us internally in our web marketing group, but it's also important to all of our business stakeholders because it really does measure performance of the web page, performance of the content, and often it'll call out key areas that could be flagged for some optimization. If we think a page is not performing very well, we often will go back to the data, look at how it's performing, and really make data-driven decisions. So here we track not only visits, page views, a bounce rate. That's a very important number for us because a web visitor can come to a page and immediately bounce off. And what does that tell us? Oh, he or she wasn't getting information that they were originally searching for. So if we have a really high bounce rate, we know the content is not performing well. So we look at that number very regularly. We look at the split between mobile and desktop. I think across our website, it's traditionally 50-50 split. It's kind of inching more towards mobile now, just because I think that's the way people are searching on their phone all the time. And we look at web traffic sources, where people are coming from, whether they're coming from Google, whether they're coming from our partners at the School of Medicine or our partners at the adult hospital. How are they coming to the website? And then we also look at the top pages and how they're performing. So we calculate all that data and we put it in a nice presentable dashboard and we review those metrics regularly. And then here we dive even deeper to page engagement. And this is where we look at the click-through rate. So you as a web visitor come to a page and you decide what you're going to click on. It will actually track. It's kind of scary once you know how much information they're collecting on us on the website. But we can pretty much tell like what pages you visited before and what keyword you searched on and whether or not you're engaged in reading the content. And so when we look at this page engagement data, this is where we can really hone in and start to pick the page apart and look for ways to improve the user experience.
Okay. Yeah, thank you, Anya. I learned a ton. I had no idea. I think also Google watches what you click on and they will serve you up what you continue to click on. So I was very, very impressed and I learned a ton going through this whole process. But what I'm going to have you guys do now is we're going to do a little polling session. And I'll open the poll up. So I apologize. I'll stop sharing this and I'll share my poll. But we're going to use Slido. So you guys can click on the, I will pull it up and then you guys can click on the presentation. Hold on 1 second. Okay. Let me know if you can see the Slido presentation. Great. Yeah. Okay, I'm going to start. I'm going to give everyone a second. You can use your camera on your phone to use the QR code, or you can go to slido.com and type in the join number. So I'll give everyone a second. Maybe somebody can give me a little thumbs up or something if you guys are in. Okay, I'm getting a couple thumbs up. Okay. Okay, I'm going to go ahead and advance the poll. Okay, so go ahead and when you get an opportunity, when optimizing the information on a website, go ahead and type in some things that need to be considered. Just give me some words from either what we've discussed or what you guys have found in your previous experience.
That's pretty cool. We need a little drum roll here or something, Jenny.
I know, exactly. Oh my gosh, language, that's huge.
Yeah, that's really cool.
Yeah, these are all really great things to think about. And I think it just goes to show that there's a lot that goes in. And again, I keep telling you guys this, but I did learn a lot through this process. Okay, so for the next poll, readability, great. I am gonna go back to, I'm gonna stop sharing this and I'm gonna go back to our presentation and I'm gonna share 3 different screens. And I want you guys to tell me which of these web pages is the most optimized, okay? So hold on one second, I'll show you the screens, the pages, I should say, the web pages. Okay, here's the first one.
Oof.
Okay, here's the second one. So this is number 2. And here is the third one. Okay, I'll go back through them one more time. So this is number 1, number 2, and number 3. Okay, and I'm going to go back to our poll. And which web page is optimized? Okay, so none of them. Anybody else have a different opinion? Might be a trick question. Okay, well, I'm going to go with the consensus. So you are correct. None of them are optimized, and that was it was good that you guys identified that, and that is correct. So none of those pages were optimized based on the information that Angie had shared previously.
So what's horrifying is all those 3 web pages are actually live and up on the website. So they're real.
That is quite horrifying. Hold on one second and I will pull up the presentation again. Angie, I hope Google doesn't actually go to them very often.
I don't think they do. I think it'd be hard to even crawl information from those pages.
Yeah, right. Okay, so thank you guys. That was great. Let me get back. Oh. Okay, and then we have a video. Angie, do you have the video pulled up? I apologize, I didn't pull up.
I do. I'm just looking at the clock and wondering if maybe we should pass over this and we can share maybe the link out after, because I know we're running short on time and I want to give some time if they have any questions at the end.
Great.
What do you think?
Yeah, I think that's perfect. So it is a really good video, and you guys, some of you on here may have already seen it, but if you haven't, this is in our slide deck, and it'll just give you some things to consider when you're optimizing your documents for Google search. Okay, And then we were going to have a group effort, and we can do this really fast. Actually, I don't know, Angie, do you think this is worth it, or we'll just do?
I mean, I think we can skip it.
Yeah. So what we were going to have you do is show you one of our pages that we did and what we did to optimize it. But I'll sort of talk to you guys a little bit about it as you kind of, we'll see the different phases that we went through. So really what we found with our information on our website was that we needed a single source of truth. And the challenge, I would say, with a lot of our documents is they were done for print, right? And so we didn't realize that we needed to change some things, or when we sort of pulled them through our HealthWise sort of single source of truth, what we needed to do to the material to make it optimized for our multiple platforms. So how could we work amongst being able to put it in Epic, our print material, and then our external website? And what we found is really you need to sort of optimize to the more of the lowest common denominator and work up from there. And so really for us is we sort of optimized for Epic and then ensured that we could pull that information onto the external website. And so our phases of optimization kind of looked like this. So this is what our print material looked like. And this is what it looked like pulled to the website. So as you can see, it's really a little bit, it's not appealing to the eye. It's kind of the bolding and the different headers didn't really make sense. It was very compact. And so then we worked with our marketing team and we got a little bit closer. We did some more work on putting H1 tags in and H2 tags. And then as you can see, once we were able to sort of really identify where things could be improved and working with the wonderful web marketing teams, we finally got it to where it was very appealing, easy to read, the bold, the headers made sense. So we had very defined H1 and H2 and H3 tags. So it really went through a journey. I don't know if you have anything to add, Angie.
I think, yeah, to go back to clean up a lot of the documents was a big lift for Jenny's team, but it really paid dividends because then coming out of the gate, as soon as we published the pages, we knew that the pages were in really good shape. And when you publish directly, it's really, really important to get those pages as Google friendly as possible.
So where are we now? So we know we need to, so based on the statistics that Angie provides us and our sort of information that we have on the visitors and the web traffic, we're really trying to continue to optimize our information, not only keeping it up to date, but really ensuring that we're getting the traffic that we would like. And so we know we need to keep optimizing. We're continuously updating the content, as I'm sure your teams are, to make sure that we have the best content out there and the most up-to-date information. And we're continually ingesting new content as HealthWise provides it to us and trying to make it engaging. And then we're also really working on, and I think somebody brought it up before, but how do you really ensure your message reaches all the different audiences that you have out there? And that's something we're really working on. And I think that we'll go ahead and skip this breakout room too, because I think that this will allow for people to just have an open discussion at the end. But really, we're hoping that people will sort of be able to open up about sort of how they make their information easily accessible on different platforms. So kind of some, oh, go ahead. Did somebody say something? So some of our key takeaways were that really partnering is important. So if you guys have partners out there that can help you make your information either more accessible to patients and family in the way that it's written or the way that it's presented on a web page, try to reach out to those people, try to find those people in either in your organizations or external that may be able to support you. Get the right people involved. Make sure the information is accessible and inclusive, and then optimize, and keep it fresh. So really, keep it up to date. And then I'll let Angie review these.
Yeah, so these are a couple of, I'll say, really good resources if you want to go back and get additional information. Google does publish an SEO starter guide, which I go back to continuously. Things get, I'll say, tweaked and refreshed pretty regularly from Google, but it's always good to have the basics documented so that, you know, if you're not quite sure how to get things done in the beginning, you can always refer to their starter guide. Moz is a SEO company, and they have a lot of key elements called out that are you might find interesting, especially if you're looking to optimize already published content. And then Yoast has a really good article about headings specifically. And I'll just throw one thing in there also, is that content really still is king on the web. People can buy ads and, you know, push their content up by opening their wallet, but Google does really appreciate, collate, and tweak their algorithm, and they look for really good content all the time. So content is still king on the web.
Okay, so we can open it up, and I'll stop sharing so we can see everybody. We can open it up to questions. If you guys, I think there might have been some in the chat. And I apologize, I have not been watching the chat. So if you did put a question in the chat, please feel free to either comment now, or I can slowly go back through it.
So Jenny, there was a question. Can you put slide 31 up again? Optimizing with Google.
Oh yeah, no problem. If anybody else has a question while I'm doing that, please let me know.
There was a question that just came in, Jenny. It says, during the process, do you involve the community advisory boards or get any feedback from the community?
Mm-hmm.
We did actually, sorry, and I'm trying to do too many things. Hold on one second. Let me share my screen. Yeah, we did. So we, and was that specific for the website or for the content, or both?
It just said during the process.
During the process. So we did do, it was both. Okay. Yeah, we did do, this I believe was the slide you guys wanted to see. We did get a lot of feedback. A lot of it was from our internal sort of feedback resources. So we did a lot of work with our family advisory committees and shared the website with them. We allowed our different, we have advisory committees all over the organization, and we worked with them to sort of go through the website and help us identify what information should sort of be upfront and then what could be layered underneath. I think one opportunity that we would like to work with more is working with our community outreach partners to sort of help have them go out and share the website and get some feedback. It was one thing we haven't done yet, and that's something we should work on.
And I'll just add to that too, is like we use, you know, quantitative data, but we also look at qualitative data. So we have a company called User Testing, and then once the site goes live, often we'll throw a quick test together, and User Testing will go in and we can ask random questions and then get feedback on the presentation of any subpages that we're looking for just regular user feedback on. And so we use that pretty regularly internally.
Any other questions, or anyone else want to share their story? Because I think that's really powerful. Like hearing what St. Jude had done and how they used the resources that were available to them, I think was really powerful. I don't know if anybody else has a story like that they'd like to share. We're open to hearing from others as well.
like we're good.
Well, thank you guys for sort of joining our workshop. And I know that we had a few technical difficulties, but our slides are available and you can reach out to any one of us. Our information is on our profiles, but we're happy to answer any questions. And ours was just a sort of an example of one sort of organization's journey, but I know there's several others out there, and this is a great, I would encourage you to network. This conference is really great for networking and allowing sort of information sharing, because I think that's how we're going to make this information more accessible to our communities at large and really make a difference. Thank you guys so much. I appreciate it.
Thank you. Enjoyed it.
Thank you.
Thank you.
Everybody.